Hi, my name is Morton Schmidt. I'm from Stratham, New Hampshire. Last June, on a Friday morning, I was driving into work and I started to get this pain in my left shoulder, in my forearm, and by the time I got to work, even the left side of my face was feeling a little numb. I walked into my office manager and said, "Kathy, I think you better take me to the hospital. So I think I'm either having a stroke or a heart attack." That's what brought me to the Portsmouth Hospital. They surmised from the workup that I had a small stroke, but during the workup, it was discovered that I had a brain aneurysm.
My name is Dr. Ajit Puri. I'm the director of the Stroke Intervention and Brain Aneurysm Clinic at Portsmouth Regional Hospital. About 1 in 50 people in our country have brain aneurysms. It's a weakness in your brain artery wall, which kind of starts becoming like a balloon, and at one point it might just pop open and giving rise to brain hemorrhage. Portsmouth Regional Hospital has a great commitment for excellence in advanced therapeutics like brain aneurysm surgery and neurointervention in general, and you have the fantastic team of caregivers right here close to home where you can get even the most advanced treatments done.
To discover that one has an aneurysm is frightful. I mean, it's a walking time bomb. It's got the potential to cause severe stroke, cerebral hemorrhage, can kill. So to realize that you're walking with that, it's very much a big concern and needs to be taken care of.
In the last decade or 2 decades, the technology has moved at light speed where we can treat these aneurysms with minimal invasive. Like all you get is a Band-Aid to go home with.
I went to see a neurosurgeon in town, and from there decided my best bet would be to come to Portsmouth Hospital. They had just opened a new aneurysm and stroke clinic.
When we have patients who come to the ER and get some CTs and MRs for any other reason, and something like a brain aneurysm is found, they should be referred to a specialist like us.
Met Dr. Puri and his physician assistant, Matt Kirk. They suggested that the procedure that they would recommend would be the interventional radiology approach as opposed to invasive surgery. Dr. Puri is involved with University of Massachusetts Medical School in Worcester, and if Portsmouth Regional Hospital hadn't opened up their new aneurysm and stroke clinic here, I would have had to have driven down to Worcester. I thought it really convenient just to have it done right here.
My name is Dr. Archie McGowan. I'm a neuro and interventional radiologist here at Portsmouth Regional Hospital. The neurointerventional program here at Portsmouth is a developing comprehensive program. It's multidisciplinary, involves teleneurology services, on-site neurology services, neurosurgery services, interventional radiology services, and strictly neurointerventional aneurysm services.
Dr. McGowan was visionary enough to understand brain aneurysm was an unmet need at Portsmouth Regional Hospital. He and I had a common vision, and based on that vision we started talking, and then me and my team partnered with Dr. McGowan and his team to provide this service.
We've developed this relationship with the University of Massachusetts where we can bring them up here 3 days a week for the hemorrhagic strokes, which require the patients to have maybe aneurysms coiled or other interventions. I feel like we have all the pieces in place to provide a comprehensive service to our community here on the Seacoast.
When you look at neurointervention, it's only 25, 30 years old, but the pace with which our technology is coming to the forefront, it's really amazing. Now we have so many tools that it is becoming very, very safe and very easy to treat these very morbid brain aneurysms. Even with minimal invasive, it's still brain surgery. For Dr. Smith, he had an aneurysm in an artery called the middle cerebral artery. We accessed the artery in his groin, went up with catheters, which are like hollow plastic tubes, and then under X-ray guidance, we were able to navigate that tube right inside that aneurysm and deploy a device. We take some pictures, make sure everything's okay, take the catheters out, wake him up, he goes to recovery. Next day, late morning, early afternoon, he goes home.
Dr. Puri, he's been dealing with aneurysms for over 20 years. He's done over 15,000 different types of procedures, so he had plenty of experience to make me feel very comfortable.
The treatment we offer is so special, like the minimal invasive treatment for brain aneurysm or any other vascular abnormalities of the brain. There's only 2 hospitals in the entire state of New Hampshire which offer it, and Portsmouth is one of them. When you don't have to sit in traffic for 40-50 minutes going into Boston, that's a win-win for everybody. the patients, the families, everybody.
When I woke up, I was very grateful that I could talk, walk, knew what was going on. So, I mean, I knew it was a success. Everybody was very cooperative, very, very helpful. I don't think they could have done a better job. So I consider myself very lucky. If I were to have problems in the future, I know right where to go and who to see.